Hello, everyone. My name is Prabha Honrath, and I'm a registered dietitian. I'm here today to review anti-obesity medications, specifically GLP-1 medications Manjaro, Ozempic, Wegovy. Oh my! We'll discuss the connection between diabetes and obesity, what GLP-1 medications are, how they work, who qualifies for these medications, and how to set realistic expectations. We're all seeing headlines and buzz related to who's using it, who's eligible, shortages, and the financial constraints. So let's dive in and reveal the reality. We know that there's a strong link between diabetes and being overweight. Being overweight increases your chances of getting type 2 diabetes, and this connection mostly happens because of something called insulin resistance. Insulin resistance is when your cells don't respond well to insulin, which makes it hard for your body to use sugar properly. When you gain weight, especially around your belly and abdominal region, the fat cells in your body get bigger. And these fat cells don't just sit there, they start sending out signals that cause inflammation, which makes insulin resistance even worse. So, being overweight doesn't just affect how you look, it also impacts how your body handles sugar, making diabetes more likely. GLP-1 medications are really helpful for people with diabetes because they do two important things. They help control blood sugar levels and they can help with losing weight and manage that abdominal obesity. GLP-1 is a hormone made in the gut when we eat food. It does a few jobs in our bodies to help manage how sugar is used. For example, it helps release insulin, which lowers blood sugar levels, and it also stops another hormone called glucagon from making too much sugar. This slows down how fast food leaves the stomach and makes us feel full. GLP-1 medications, also called GLP-1 receptor agonists, work like the natural GLP-1 in our bodies. They activate the same receptors as natural GLP-1, which means they help release more insulin when blood sugar levels are high, and this helps keep blood sugar levels under control. They also stop too much glucagon from being released, which stops the liver from making too much sugar. One of the most notable effects of GLP-1 medications is their ability to promote weight loss. Now, this weight loss occurs through multiple mechanisms. So let's explore some of those different mechanisms. This medication acts on the brain to reduce appetite and increase feelings of fullness, which leads to that reduced food intake. It also delays stomach emptying and helps regulate the rate at which food is digested and absorbed, which can contribute to reduced calorie intake as well. Some GLP-1 medications have been shown to increase energy expenditure, potentially further contributing to weight loss. And these medications have been associated with reductions in visceral adipose tissue. This is the fat stored around internal organs, which is particularly beneficial for metabolic health. So, by simultaneously improving glucose control and promoting weight loss, GLP-1 medications offer a unique therapeutic approach for individuals with type 2 diabetes, especially those who are overweight or obese. This dual benefit addresses two key aspects of metabolic dysfunction, ultimately leading to improved overall health outcomes for patients. The eligibility criteria for GLP-1 medications typically depend on individual factors such as the severity of health status and the response to other diabetes medications or lifestyle interventions. So here are some guidelines below. So GLP-1 medications are primarily indicated for the treatment of type 2 diabetes. Individuals with type 2 diabetes who have not achieved adequate blood sugar control with other oral medications or who require additional treatment beyond oral medications may be candidates for GLP-1 therapy. Patients who have trialed and failed to achieve target blood sugar levels with oral medications such as metformin may be considered for GLP-1 therapy. GLP-1 medications are particularly beneficial for individuals who are overweight or obese. Therefore, patients with a body mass index, BMI, above a certain threshold, usually 30 or greater, or those with a BMI of 27 and greater with comorbidities such as hypertension, dyslipidemia, or obstructive sleep apnea may qualify for GLP-1 therapy. Certain GLP-1 medications may be suitable for patients with renal impairment, and factors such as patient preference, tolerance of side effects, and convenience of administration may also influence the decision to initiate GLP-1 therapy. Now, it's important to note that individual patient characteristics and medical history plays a significant role in determining eligibility for GLP-1 medications. Therefore, decisions regarding initiation of this therapy should be made in consultation with a healthcare provider who can assess each patient's unique situation and tailor treatment recommendations accordingly. When you're thinking about using GLP-1 agonist medications for diabetes, it's good to know what to expect with blood sugar, weight, side effects, and getting the medication. So let's break it down. These medications can help lower blood sugar, but how much varies for each person. So keep an eye on your levels and work with your doctor to adjust the dose if needed. These medications might help you lose weight by making you feel less hungry, but the amount of weight loss can be different for everyone. And of course, eating a healthy diet and exercising can help improve your success. Like any medicine, they can cause side effects. Some of the side effects have been recorded are nausea or diarrhea, and these usually get better over time. Working with a dietitian can also help optimize your toleration. Cost. These medications can be expensive and insurance might not cover them well, so ask your doctor about cheaper options or programs to help pay for them. And then there are shortages, so you may not be able to acquire the medication. So reach out to your doctor to find alternatives or places where you can get the medication. I'd also keep in touch with your pharmacy to make sure you don't run out. Now, we just hit the tip of the iceberg. Next week, we'll explore the intricacies of dietary management, exploring strategies for effectively managing diabetes and obesity, regardless of whether GLP-1 medications are part of the equation. As we navigate potential shortages and fluctuations in insurance coverage, it's crucial to equip ourselves with sustainable, healthy behaviors that support our health goals. So stay tuned for practical insights and guidance to empower you on your wellness journey.